So when picking the right implant size for your body type, I think number one, it's really important to consider your actual goals of what you want to achieve. But more than that, it really comes down to anatomy.
I take a lot of detailed measurements because it's so important that the implant that they choose fits in their body. And then we have a lot of discussion about what it is that they want to look like. Do they want to look natural? Do they want to look more augmented? And then that helps us look at the portfolio of Mentor implants and decide which one is best for our patients.
I think that patients think about volume. They just think about they want to be a C cup or a D cup. But as a surgeon, we think about dimensions, because that's really probably more true to their frame, because the bodies are quite different from one patient to the next.
So I really use measurements, and that can be helpful in just assessing body types, but then also the space that's in somebody's chest, because that's really different from person to person and can affect the safety of the result.
Choosing an implant with a patient is one of the most important parts of the process, and honestly, it's a lot of fun for them too.
My practice, we actually try on implants. Let's try on some different versions, because there's a tolerance. There's not just one implant for one patient. There's a range that would be appropriate, and there's a range that's not appropriate. So we want to try to, within that range, figure out which one resonates the most with the patient to make sure they're part of the process of determining their final size and the final look of the breast.